Cheek fillers or implants? Hi, I'm Dr. Dominic, Elite Facial Plastic Surgery. The big difference between the two is one is a permanent option and the other is not permanent. Now, in regards to wanting to know which one is right for you, a lot of that depends upon what you're seeking. If you're wanting an option to fill the area, obviously both will achieve that. However, one requires surgery with the implants and the other one is a filler that gets done in an office setting. Now, the nice thing about the filler is that for patients who are wanting something to get done and don't want a lot of downtime and they're okay with maintaining it, then a filler is a great option. I also steer patients to think about fillers if they've never done it before. I have very rarely instructed patients to go straight to an implant. And the reason why is you want to make sure that you like what you're going to be doing there. So the filler is a really good option. Now, under the filler category, there are different materials that are essentially implants that you're using. And what I mean is the more common one you've heard of are probably the hyaluronic acid fillers. They're more like a jelly. They're clear. They're very forgiving. You can mold them. If you don't like them, you can dissolve them. And then another type of filler is what's called a calcium hydroxyapatite filler. It's more of like a paste. The nice thing about it is that you get a lot of what I like to say bang for your buck. Now with these, they don't dissolve as easily if you don't like them. However, when you're filling this zone or the cheek area, there's a lot of forgiveness because there's so much soft tissue. Now, commonly we talk about the cheek area, but many times it may be an area just below the cheek, what we call the submalar region here. This area is referred to as the submalar triangle or submalar zone. That's a common place to utilize fillers or implants. So for most patients, what I usually recommend is starting off, with a hyaluronic acid filler. If you're really timid and not sure, if you feel fairly comfortable with your surgeon, whomever you're speaking with, then you can go on to the more heavier fillers and feeling comfortable they'll be able to achieve what you're looking for. Now, once you do that filler and you're like, wow, I like this, but I don't want to have to keep coming in or, starting to get costly, then you may want to think about going to the next level of more permanent filler, which is basically an implant. Now, implants are made of silicone. And the nice thing about silicone is that it's inert, the body encapsulates it, and it'll be there for life. Now, with that being said, it'll be there for life unless you have it removed. With the implants, though, over time they become very sophisticated and they have different shapes. So depending upon what you're really looking to address will determine what kind of shape you use. Whomever you consult with, if you're thinking about doing this, should have a booklet showing you the different types of implants that are available. Here at Elite Facial Plastic Surgery, we have that, showing you what we would be implanting for you. I would also discuss to your surgeon, the technique that's utilized when placing that in. Now, the one thing I also want to talk to you about when it comes to the implant side of things is that you can do what's called fat graft, and fat grafting is in itself technically an implant. But with the fat grafting, what some patients like about that is that it's your tissue. I mean, you're basically harvesting fat from an area, let's say the abdomen, for instance, and then you are going to take that fat and then place it in the cheek area. It's a great option. It's your tissue. The risk of infection is very low. Now, the one downside of doing the fat grafting compared to the implant is that there is a little bit of resorption over time because, when you're taking tissue from one part of the body and transporting it to another, there's a little bit of trauma that goes on. So not all the cells, quote, may take. But for the most part, you can kind of overcome that by just augmenting a little bit more at the time of the procedure, or if needed, you can always touch that up. So again, I know it's a lot of information to take in, but choosing which option's best for you is really dependent upon you, and you have to discuss that with your surgeon, what you're seeking. But I think starting off with an injectable filler is a good option, and then ultimately migrating to a more permanent option like an implant or fat grafting is a reasonable choice. So I hope this sheds some light on this topic. Again, I'm Dr. Dominic at Elite Facial Plastic Surgery. Please check out our YouTube channel. I answer multiple questions. If you have any questions or comments, please post them. I'll take a look.